specializes in OBGYN and
Today I'm
family
doing
planning
legs and
as well. And
glutes.
get this, she has been a doctor now for 18 years already. With that, we welcome the extraordinary Dr. Jenna Newman to the exam room. It is so good to have you on the show after all this time.
It is so good to be on the show. Thank you, Chuck. I've been looking forward to this for a really long time.
You and me both. And you are coming over here stateside to Washington to present at the International Conference on Nutrition and Medicine. And you will be talking about, matter of fact, the title of your presentation is How Can Female Hormone Health Be Improved by Lifestyle Change and a Plant-Based Diet? Phenomenal topic. We've talked about that a lot on the show, but I'm really glad that you're here to talk about it today because this is going to be an episode that I think, Dr. Newman, I want all of our female listeners, the female exam roomies, to share with their significant others because I'm just going to be asking you questions from the guy perspective. And a lot of times, us guys, we just don't understand. So it's on you today to help us understand if you're up for the challenge.
I'm definitely up for the challenge, Chuck, and I couldn't agree more. I think a lot more families, a lot more marriages would be a lot happier if the guys knew a little bit more about the hormones that their family members and loved ones have to deal with every day. So yeah, I am definitely up for that.
Okay, well let's raise those health IQs, as I like to say. I guess just based off of the topic of your presentation, I mean, how can the hormones of females, how can they, like that health there, improve if they make some modifications away from that standard Western high-fat diet and sedentary lifestyle into more of a healthier diet where they're up and they're also active?
Yeah, you can make huge differences, and I think a lot of people don't realise that because, we certainly doctors, we talk about the menstrual cycle and we talk about periods and about fibroids and about endometriosis and about menopause. But we're not really taught about how our lifestyles can impact these conditions. And, I say conditions, but of course, periods and menopause is what every woman will go through at some stage of her life. And it's something that even women don't really know a lot about often before they go through it. And so I think education on this is so important. And yeah, diet is one of the biggest things that we can do in our own lives to help improve our hormonal fluctuations. And as you say, it's not even just about diet. We can do things like movement, prioritizing sleep, looking at our overall well-being. All of these things play a vital role actually in helping us to manage our hormone health in the best way possible.
All right, so let's start with the diet here. Over here, it's referred to as the standard American diet, the SAD diet. But clearly, the fast food fascination is not just limited to within the United States. How much of a role is that playing in the overall health of your cohorts over in the UK?
Yeah, I think that we have a very similar dietary pattern. Over here, we don't call it the SAD diet, we call it the Western style diet because essentially, we're not American. But yes, it's the same thing really. And we see that playing out with our rates of obesity. And it's important as well when we look at other conditions that are related not just to genetics but also to lifestyle in terms of hormones such as polycystic ovarian syndrome. And I think it's really important to empower women and men to recognise some of these things because, believe it or not, I don't know if you knew this, Chuck, but about 1 in 10 women will actually potentially suffer from polycystic ovarian syndrome, many of whom, maybe up to even 80%, don't even realise that they have it. And so it's really important, I think, not only to be aware of the things that we can do to improve our hormone health, but also just some of the signs and symptoms of these hormonal challenges that we'll have that will help point us in the direction of greater health.
What are some of those symptoms? I mean, if you're talking about 80% don't even recognize that they have it, are we talking about subtle symptoms? What should women be looking for?
Well, if we do a little bit of a backtrack, I think, when we're talking about periods, for example, they've been occurring earlier and earlier in the Western world, and that may well be something to do with our diets, and it's not necessarily just that we are generally taller or healthier or have more access to nutrition, I think premature puberty is also something to be really wary of, because that's happening a lot more frequently. And premature puberty is related to increased risk of heart disease later in life, even adult onset asthma, obesity and diabetes. And so when you go through premature puberty, essentially your periods are starting earlier than they should do, and many children now are potentially starting their periods even as early as 7, 8 and 9, and that would be classed as premature puberty, and that's something to be aware of as parents. And then moving through into those teenage years, many teenagers will notice that their periods fluctuate. They may not happen every month like clockwork. And especially in South Asian populations, if you're going through your periods in your teens and your periods are irregular for more than a year, that's actually a fairly important sign, because that could be an indication of polycystic ovarian syndrome. And the things that we look for with polycystic ovarian syndrome are irregular periods, or periods that have been absent for a period of time, as well as sometimes excess facial hair, sometimes excess weight, and there may be sort of more subtle symptoms that you wouldn't necessarily associate with polycystic ovarian syndrome, such as depression or anxiety or sleep disturbances. And the main thing that really drives that is insulin resistance. And so it's a hormonal condition that also predisposes people to type 2 diabetes as well. So I think the main thing that you'd look for would be delayed periods, so periods that are happening less frequently than monthly, and you may also look for other signs of androgen excess, which would be things like perhaps extra facial hair, sort of thinning of the hair on the head maybe, or extra weight that you might be carrying.
None of those sound particularly appealing. I can't imagine. I want to go back to what it was you were saying, though, about women starting their period. You said as young as 7 years old. Is that right?
That would be premature puberty, yes. That's obviously, they're children. They shouldn't be having to deal with these things at that age. And it's happening more often in Western societies, yeah. And I think that it's probably to do with not just extra nutrition, not just the fact that we have more nutrition that we've got access to, but actually I think it's clearly harmful at that age to be going through puberty. And I think looking at the data that we have, although I would love to see more data, I think that there is a link with excess hormone exposures through things like microplastics and things like that in our environments that we haven't really looked at enough. But I think we need to have much more research on that.
Yeah, when you use the term extra nutrition, I'm assuming you mean excess calories. And that's just kind of the way that it's interpreted here over in the US, is that right?
Yes, I suppose I do, but not just that. I suppose at times in the past there have been nutritional gaps too, that we've been able to fill nowadays. So things like iodine deficiency, for example, are really common. In fact, in the UK, there's a condition called Lancashire neck, which back in the 1800s used to actually indicate that you had iodine deficiency because of the goiter in your neck, because the soils in that part of the country were very iodine poor. And now, of course, we have a lot more access to iodine, unfortunately, from cow's milk, but also now, thankfully, a lot of our plant milks are fortified, and we can also get it from supplementation and certain forms of seaweed. So I don't just mean excess food, I also mean that we're hopefully able to fill those gaps in nutrition that we may have had in years gone by.
Obviously as a guy, I'm never going to understand the monthly cycle, the menstrual cycle, but I would imagine, though, being that young, I'm just blown away, being that young and having that starting to occur with your body, I mean, that's gonna like freak a young girl out, right?
Of course, especially if they haven't been told what it is. You're basically starting to bleed, you probably think you're dying. This is horrible for them. So yeah, I think more education is needed. It shouldn't just be up to mums to teach their daughters, because there's many kinds of blended families these days, and there's many kinds of families that you can't just rely, I don't think, on mums sharing that maternal wisdom with their daughters. I think it's really important actually to have this education in the school setting as well, so that young girls can understand what they're going through and what to expect, and to learn about sanitary products and how to use them. And in fact, even the word sanitary products, I don't really like, because it implies that you're dirty when you're having a period. I think we should just call them period products, perhaps. That's my opinion.
I mean, it's not so subtle wording. You're not wrong on that. It just conjures up like kind of a weird emotion with a sanitary product, right?
It's horrible, isn't it? I think we just need to shake this all up and just call it what it is. That there's period and we've got period products.
I mean, yeah, right? I mean, I don't know if the person who thought of that term was trying to eliminate the term period, but sanitary product, that's like 20 times more awkward than a period product, right? Oh my goodness.
I mean, so.
And what about the poor blindfold gentleman who goes down and he's like, sanitary products, this must mean, like bleach and soap and things like that. And he's on the completely wrong aisle in the grocery store. I don't know.
Yeah, you definitely don't want to be putting that stuff in your own.
No. I want to ask you about another condition that is hormone driven. This is one where, I mean, on this show, I was really introduced to it for the first time, and the stories of transformation and health rebounds have just knocked me over. I'm talking about endometriosis. How much of that is driven by hormones and diet and lifestyle?
Yeah, I think endometriosis is a really important topic to educate ourselves on, men and women, because many women go undiagnosed for a long time, and it can actually really affect their quality of life and their fertility if they don't receive a timely diagnosis. So endometriosis is a condition where you get essentially the womb lining, or the endometrial cells, can start to crop up in other parts of the body, usually the pelvis, but it can happen anywhere. Rarely even endometrial deposits have been found in places such as the brain and lungs. And the problem with that is that when you have your monthly bleed and your cycle where you would shed blood through the womb and through the vagina, when you have endometriosis, you have those womb lining cells, those endometrial cells, but they're also bleeding in other parts of the pelvis usually. And that can cause irritation, that can cause localized inflammation. And when it continues without having a diagnosis, you could be left with all sorts of problems. You can have parts of your bowel or bladder sticking together. You can have pain during sex. You can have pain even when you do a poo or a wee. And you can have pain at other times in your cycle. So people can get really confused. Doctors often, or perhaps misdiagnose it as irritable bowel syndrome, because the pain isn't necessarily classically just with your period. You can get it at other times as well. And it's really serious. It can affect women's lives immeasurably. They can have lots of days off sick with horrendous period pain. And interestingly, period pain can even be as painful as a heart attack, because many people, especially those with diabetes, aren't necessarily aware that they're having a heart attack when they have one. And so, this is a really nasty, visceral pain that will give women a really hard time, and they don't even know that they've got it unless they can seek a proper diagnosis. So it's really important that if you're having period pains that seem unnaturally painful, like really unpleasantly painful, that leave you in bed all day, unable to move, and if it hurts to have sex, or if you get pain when you're peeing or when you're pooing, these are really important signs to go and see your doctor.
Yeah, and I've heard stories, as a matter of fact, people have come on the show and talked about their own experience with it. And one woman in particular was talking about having to call out of work and would just lay herself across the back of a chair to like put some sort of compression on the cramping. And then when her roommate would get home, she would be like, please just walk on my stomach. And the roommate was like, what in the world is going on? Just do it. Because the pain was so intense. And so to hear you say that it can really mimic kind of the feeling of a heart attack, like that doesn't necessarily surprise me. I mean, it sounds horrific, but that is like some really intense pain. Again, from a male perspective, I don't think that many of my fellow guys recognize just how painful of a condition that can be.
Yeah, it's heartbreaking, really. And I don't. The sad thing is, I don't think a lot of women recognise how painful it can be either. So if they're going through it, and if they're getting pain when they pee, pain when they poo, horrific pain during their periods, even pain when they're having an orgasm, and they think to themselves, "What's wrong with me?" They assume, well, it can't be anything wrong. It must just be normal. So many women have come to me in the past and said, I just get these really bad period pains. And then when I go through it with them and actually get a feel for what they're going through, I think to myself, well, they've been suffering for years and they've just put it down to being, maybe just overreacting or just trying to get used to the fact that it must be normal for women to go through this every month. And it's really not. And I suppose the advantage of talking about it on a show like this is that if women can listen and men can listen, and they can sort of pass on this wisdom to each other, so that if someone's really suffering, they can go and get checked out. And the good news is that if you get a timely diagnosis, then you can have medical treatments to help. And of course, as you've intimated, it is helpful to instigate lifestyle changes as well that can improve the pain that you're experiencing. So yeah, there is good news in this, and I'm glad that we're talking about it.
Yeah, I think the biggest turnaround that I heard of was with a woman by the name of Catherine Lawrence Ireland. Are you familiar with her story at all?
I think it's one of the stories that Dr. Neil Bernard has shared, and I loved hearing it. So yeah,
I mean, macaroni and cheese every day, all day. Goes in for surgery for endometriosis in just a few, I guess weeks, maybe a month or so after going plant-based. Doctor opens her up and closes her right back up. All that's left there is a little bit of scarring, but the endometriosis is gone. The doctor called it a miracle, and her mom called it just a plant-based diet. So, it's incredible to me how someone can abuse their body for so long with this unhealthy diet and lifestyle, and yet, in such a relatively short amount of time, it can repair itself.
It can, yes, although I would give you a caveat to saying that many women who are suffering from endometriosis are not necessarily eating in an unhealthy way, and also that that kind of story is super inspiring, and I would love for all my patients to eat a predominantly whole foods and plant-based diet, but sometimes those kinds of transformations are not possible, and I don't want anyone to feel guilty if they've really tried hard and they still end up having some issues. But yeah, it's really exciting to hear stories like that, and it makes us feel, I hope, more empowered that we can make some changes ourselves and get some real benefits. And interestingly, it's not even just about the food. There is some correlation, as I sort of mentioned earlier, with plastics too, plastics exposures, things like phthalates. There have been studies to show a correlation between higher phthalate exposure and higher risk potentially of endometriosis. So that's something to also talk about, thinking about ways in which firstly we could get more research on this, but also from an individual point of view, what can we do to reduce our exposure to these kinds of plastics in our food and in our drink. And I think that would be true not even just for women, but for men as well. There's some research to suggest that BPA exposure, phthalate exposure is associated with potentially higher rate of issues with your sperm count, issues with testicular abnormalities, being born with one testicle. There's also a condition in men called hypospadias, where the wee tube comes out of the penis in the wrong place, slightly lower, and that has all been associated potentially with exposure to plastics. And so we would all do well, I think, to limit our plastics exposures wherever possible.
See, now that's an interesting thing. How, as a physician, do you approach having those types of conversations with your patients? I would imagine that very few of them walk through your doors and are expecting to talk about plastic when they're there for a condition that they completely would disassociate with that.
Yeah, I know, it's tricky, and I think I just take a very pragmatic approach, and it depends on the person, and it depends on I think the kind of conversation that we've been able to open up. Most important thing I think in any consultation is to listen first. And I'm really fortunate because in my practice, I work in a National Health Service practice. I have patients coming to me who don't necessarily expect diet and lifestyle advice at all. So it's actually quite nice to take them by surprise and talk about these things and hopefully empower them. And the beauty of it is they can come back again another day. They don't get charged at the point of service. So if I feel like they need to come back and see me, I'll say, why don't you book an appointment in 2 weeks, in a month, in 3 months? We can review it. It gives them some accountability. It gives them somebody who cares enough to see them again. And it gives me the opportunity to actually take the time when people are kind of receptive to it, take the time to really talk these things through. And you're right, people don't expect to talk about diet, lifestyle or plastics, but I think it's actually quite a relief to them when they can find things that they can really change and improve on. It doesn't have to be everything. It doesn't have to be sort of switching to 100% vegan or taking every possible plastic source out of your life, because these things are really hard and it's almost impossible to do that overnight. But if we become aware, I think awareness is so key, and that's where I always like to begin.
So some of these conversations, I would imagine, for you are quite interesting. I would imagine that a number of your patients kind of have their heels dug in. I'm not going to change. I'm going to keep living this way. And it can be really hard to try to get that information across, especially when what we were just talking about, they're really ill prepared for that conversation when they came in that day, right? So how do you help move the needle when somebody is really kind of dug in there?
I listen, because chances are, if they're really dug in, there's a reason why, and they may have some fixed beliefs that they want to explore with me regarding their health and things that have happened in the past, reasons why they can't change, and you don't really get anywhere by telling people what to do. You have to listen first. So that's what I spend most of my time doing. And then if you ask the right kind of questions at a time at which they're most receptive, then they'll often come up with the answers themselves.
And I want to go back also to something that you said when we were talking about Catherine Lawrence Ireland. You're like, that's a phenomenal story, but it's not everyone's story. I think, and thank you for saying that. Because there are a lot of people who make these transitions and they are expecting that level of healing that quickly. How do you manage a patient's expectations? Because there's somebody right now who I'm very close with who is going through that transformation, and it's just not happening as quickly as they would like. And it's hard for me to sit here and kind of see the angst and the frustration. Yes, they're making progress, but it hasn't been this overnight miracle. How do you kind of taper the patient expectations and keep them motivated?
It's a really good question, and it's very individual. And I think the most important thing is to actually just encourage them to focus on what's motivating them to do it, and also how they feel about doing it. Because if there's a lot of angst and frustration around it, and that's not going to feel good in the body. And what I would love for my patients and for anybody listening to know is that these kinds of changes, sometimes they take time, sometimes they don't. We're all so different. We've got different backgrounds, we've got different levels of hormone exposures. We're talking about hormones right now. We're not all born with the same hormonal milieu. We have potentially microplastics exposures from birth. We have, smoking exposures from birth. We have all sorts of different reasons, physically, emotionally, why we would not necessarily all react in the same way. And of course, also, I think when it comes to things like even weight change, I think it can be really challenging, because people will have done 100 crash diets and they will have gained the weight again. And that leaves you in a very unfortunate position metabolically, where your body's really trying to hold on to all those extra pounds. And of course, those hormone exposures that I talked about, they're generally stored in our fat tissue, which can be a problem as well. We have other thyroid issues potentially. We have microbiome differences. We have different courses of antibiotics that we've taken in our lifetimes, and how they have impacted our individual microbiome and how our microbiome responds to these changes. And we have different sleep patterns. We have so many different stress patterns. And I think that we're all so unique. And what I would hate for someone to go through is to think to themselves, right, well, I'm going to have a complete 180 health transformation within a month, within 2 months, within 3 months, because that doesn't happen for everybody. But if you can just maintain feeling good about who you are, regardless of what your body looks like, regardless of how your body feels, focusing on the things that you're grateful for, focusing on how pleased you are that you've even begun to make changes. Look at the progress that you've made so far. Feel good about all those changes that you've made to your life, and focus on that rather than focusing on what you're yet to achieve.
You're a glass half full type of person, aren't you? I can see you've got that sunny disposition.
Oh, you know what? I am. I can't help it. It's just the way I was born. And you know, we're all born differently, but I think, yeah, I am for sure. And it's interesting because, you know, when I grew up, my family were not like that, and so I think, you know, it's interesting how our upbringing can affect the way we see the world and what we think of the people in it. And so I would encourage anyone out there who's struggling to just be a bit easier on themselves and to speak to themselves as they would a good friend.
Wow. See, I like that. You know, somebody once told me that happiness is a choice, and I didn't really know what they meant until I got a little bit older. But then, sure enough, you know, that's that wisdom of the adult that as a kid you just kind of take for granted. But yeah, it's 100% true. You definitely made that choice. You can tell, like, you've been smiling this entire interview. You know, I dig that. I want to go back to what it was you were talking about a second ago. You mentioned crash diets, and since we're on the topic of hormones, I'm just curious, like, what happens to a woman's hormones when they basically turn their body into a crash test dummy, and they're crashing time and time and time again with all of these wacky diets?
Yeah, I mean, I think instinctively we all know it's not great for our bodies to do that. Men too, but I think there should be more research into how women's bodies are affected by this. And also fasting, I think, is an interesting topic because there's lots of mixed data on that. And I think especially coming up to menopause and for women who are having regular monthly cycles, we need a lot more data into fasting, which is, you know, some people could take that into another form of crash dieting, couldn't they? And disordered eating as well. I think we need to know a lot more about how that affects our body and our hormones, and we just don't know a lot of that. But what I will say is that many different people have to do a lot of different kinds of work to achieve the same sort of size. So you could have 10 people all stood together who look the same on the outside physically. You know, they may have the same weight, they may even have the same muscle mass, but then one on the left would have to do a 10-kilometer run or a 6-mile run every day, and consume maybe 400 or 500 calories less every day to maintain that body size compared to the person on the right. And that's just, you know, that kind of blows out the water, the whole kind of calories in, calories out simplicity that people often talk about. Because actually, as I mentioned, that hormonal milieu will change based on whether we've starved ourselves in the past, whether we've gone on crash diets, how much our metabolism is trying to get us back to a certain set point, and how long we've been doing that for. And then, of course, you know, there are people who have had patterns of disordered eating, which can also impact our metabolism. So I guess the sort of take-home message would be slow and steady for the win. Don't be disheartened if you are not steadily losing weight in the same way that you were maybe when you started eating more healthier, and really make it into your new lifestyle. So you're not going to be looking at the scales every day or even every week. You're just going to be consistently making the choices that feel good to you and your body, without worrying too much about looks, I'd say. Just worry more about how you feel and how the food's making you feel.
What research have you seen that shows the slower you make these changes, or the slower the weight comes off, the more likely the person is to be successful with maintaining that weight loss long term?
So the research is quite mixed. I've read some research to say that it's actually better to lose it quicker and then maintain it, and I've read others that say slow and steady is better. And so for me, I think people have to do what works for them, but I know from my own practice and from reading about the experiences of many other people that crash diets are not particularly helpful. The vast majority of people will just regain the weight again. So it really has to be something that you feel you can sustain for a lifetime. And that's something that's quite hard to get your head around.
Build new habits.
Because, a lot of people, I mean, you can speak from personal experience, I know, Chuck, because you've been on an incredible journey yourself. And I'm sure you'll agree that the way that you live now is very different from the way that you lived when you were much heavier. And that's something that you've been able to maintain as your lifestyle, as your way of being. And that's something that I wish for everybody.
No question about it. There's absolutely no question about it. It is so much more than just the food that I'm eating. I mean, everything in my life is different, right down to and including a slight disposition like you, which is, critically important. There's so many layers to this, but I agree. And it is different for everybody as well. And once you find what works for you, then you're really going to be in good shape. The way that I always explain it to people when they ask, I'm like, there's no one size fits all. There are some universal truths out there that we can all build upon. For example, I believe in my heart of hearts that the plant-based diet is the healthiest diet out there. It gives you the best possible chance for long-term health, optimum health, well into your golden years. But I mean, that's just the foundation, right? You still have that whole house to build on top of that, and you can custom build that house using that foundation, that healthy foundation, and just building the best house for you based off of what works for you. And that's that individualized thing. And that finding, though, what worked for me, it was a lot of kind of trial and error, and that's, I guess, why people call it a journey, because that's exactly what it is, but it makes it so worthwhile. And I know we're running out of time, but you've got your own journey. I would love, Dr. Newman, to bring you back so that you can share your incredible story with the exam roomies as well.
Of course, I'd love to come back anytime. And we've only just skimmed the surface of hormone health as well, but you're right, I think it really is the journey. And, in the context of a journey, you have to walk, I don't remember the exact line, but you have to walk in someone else's shoes to really understand what they're going through. And so it's important, I think, to have compassion, not only for yourself, but also for others around you if you see them struggling, rather than sort of judgment, because we've all been through different things in our lives, and it's quite hard. Like, for example, adverse childhood experiences. We know from the data in the field of psychology that many people who are struggling with weight issues have also struggled with physical or mental or sexual abuse in their childhood and beyond. And there's a huge correlation between the two. So I think, again, that's something to be mindful of, just to be aware that one person's journey is not going to be the same as another person's.
Absolutely. And that's why I'm so excited to be able to share yours in the future. And two more quick questions here before I let you go. I've started to get all of these emails from exam roomies who are like, you always have on such wonderful guests, but you never ask what they eat. So what does the average day look like for Dr. Gemma Newman as far as what's on your menu?
Okay, so I generally love porridge or oatmeal, which I'm sure many of your exam roomies enjoy as well. I add chia seeds, I add hemp seeds, sometimes I hold hemp seeds, I add flax seeds. I love having a little bit of nut butter with that, almond or peanut butter, and I have lots of fruit and berries on top. It really fills me up for the day, especially with the added nut butter, which I enjoy. And breakfast smoothies, that's another one that I really enjoy, especially in these summer months. And I guess when I come over to Washington, it's going to be really, really, really hot. So I'll hopefully enjoy a breakfast smoothie there as well. I love to have soy milk as my choice. And I haven't talked to you about the hormone benefits of soy, but we can come to that another time. I love that. I love adding fresh greens and berries to my smoothies. What about, in my book, I forgot to even mention this, I've got loads of great recipes in my book, The Plant Power Doctor. So there's a whole chapter on hormone health, as well as, heart health, gut health, immune health, skin health, plant-based for all ages, cancer. There's a lot of different things in the book, but there's also a lot of different recipes and things that I enjoy making. So lunch, I really enjoy having a whole grain sandwich. I actually really like to have hummus and grated carrot as well, and I'll add in some salad. I like having pancakes. My husband makes great pancakes, and I really enjoy hearty meals. So in the winter time, I'll look to make things like stew. I have this great shepherd's pie recipe or cottage pie. I don't even know if you have that in the US, but it's a really comforting meal here in the UK. And I really, really love my chickpea curry as well.
Love me some chickpea curry, and you better believe we've got shepherd's pie over here. It is quite tasty, yes indeed. And by the way, when you're in town for the ICNM, you and I, we're going to go right next door. There's this wonderful place, completely plant-based. I'm going to get you this smoothie that's going to knock your socks off. It's called the Cacao Cow. You a fan of chocolate? You like
Yeah,
chocolate?
of course, I love chocolate, yeah.
All right. You and me then, we've got a date at this place called Fruitive, and it's going to be fantastic. I'm telling you, you're not going to want to go back. You're just going to want to stay right there and have another smoothie and another smoothie. That's how good the Cacao Cow is. I'm just telling you so you can get mentally prepared for what's going to happen.
Okay, the cacao powder. Well, I have to hold you to that, so I will make you